everyone, welcome to my channel. Today I have a very serious subject and I titled it Reality and Common Sense. And I won't be mentioning names other than my own and my daughter. I want to maybe open up somebody's eyes regarding not always taking what the medical profession says to you. Now, let's face it, we can't live without doctors. We need the medical profession, but they are human. They do make mistakes. And I will use myself and, like I said, and my daughter for an example. I just want people to stop panicking and start using some common sense. Don't believe everything you hear. Now, I know I'm going to offend some, and as I said before, so be it. This channel is not to win brownie buttons. This channel is to get what I believe out to the public, some truth, or at least make you do some research and ask questions. So I'm going to start with myself. I have thalassemia, which is Mediterranean anemia, and I was born with it. Thank God only one of my parents had it, because if both your parents have it, you usually don't live to be very old. You usually die as a child or maybe an early teenager. But I didn't get diagnosed until I was in my 40s. And I worked in a hospital, by the way. I'm a retired nurse. I had blood work done every year, seeing the doctor on schedule. And what thalassemia is my red cells are odd-shaped and small. And it is genetic, but it is detected in blood workup. So apparently the doctors never told me about it. And I remember the lab tech telling me once, Joe, your blood workup's a little off, but without revealing, because, you know, that's his job. My doctors never told me anything. Well, to make a long story short, I hurt my leg and they couldn't find out what was wrong, so they sent me to a neurologist, and he did a bone scan and complete workup. And he's the one that diagnosed me, and he said, do you know you have thalassemia? And this should have actually been detected when I was a kid. And I won't get into a lot of the symptoms, but there are some. I have the thalassemia minor, which that's why, other than feeling tired and a few little symptoms, it's not drastic in my life. And I'm a very stubborn, determined person, and I just keep going. Anyway, the reason why I'm even bringing this up front is when the lab tech said that to me, I should have investigated. I should have went to my doctor and said, you know, can I see my lab slip? And now I do request my lab slips, because if you don't know how to read them, you can actually go online and learn how to read at least some of them. So, good idea. And I really believe in getting a second opinion. Remember, doctors are human. Tests sometimes fail. Tests are not 100% accurate all the time. Think about what's going on right now, too. And you can even do research and find out that a lot of people have been misdiagnosed. In this case, I was misdiagnosed. And I won't get into, well, maybe I'll tell you a little bit about, I have lymphedema, and that I had a couple of weeks where I could not walk. Went to the ER. They totally had no idea. Did an ultrasound on my legs. One of my lymph nodes does not function, apparently. So I get these fatty deposits, and it has nothing to do with obesity. But finally, my wonderful cardiologist, who is on the ball, I'll use a funny term, figured out with, some testing and stuff that I have lymphedema. So doctors do miss things, and sometimes they misdiagnose you. So be active, be proactive in your life, and don't get this false security too that, you're going to the doctor and everything's going to be fine. Be realistic. Same way with right now with wearing mask. That's not 100%. So be careful, yes. Do what you're supposed to do, but don't panic. That is something that I think is bothering me more than what's going on is the people that I know who are in a panic and are not using any common sense. You're more apt to get sick when you're in a panic. So I'm gonna go on to my daughter, and I'll show you a picture of my beautiful little girl who passed away in 1969. And she was born May 30th, and back in the 60s, that was Memorial Day. And once a year on May 30th, I do a little memorial. So I will do another video on her birthday and maybe tell you some things, excuse me, that she said before she passed away. She's the one that gave me my faith and my strength. So first of all, I want to tell you about her life and how I felt like part of the medical profession handled it correctly and part didn't. And my daughter and my son were supposed to get a tonsillectomy, and they both had a cold. So the doctor in a small town in Idaho, and he has passed away a long time ago now, he was a wonderful doctor, said, I want to do an x-ray before I do surgery. Well, my son got to have his tonsils removed, but my daughter, they found, had an enlarged heart. So he sent us to Portland to have some tests run. Now here's a specialist in Portland. And we did the testing, we went back home. When my doctor received the results, he contacted us, explained the whole thing, that she had muscular dystrophy. And, excuse me, my allergies are something else today. She had muscular dystrophy, and he was an older doctor, very wise. And this always lives with me. He said, and he always called me by my first name. He said, Joe, live every day like it's her last. And he let me know that she was not going to survive. And this was 6 months before she died. And he said, feed her anything she wants. If you have to fix her something special, because she had a very, very poor appetite and was very, very thin. And when she passed away at 9.5 years old, she only weighed 42 pounds. So I tried to live each day to the fullest with my little girl. But why I'm bringing this story up, 3 months after she passed away, I get a letter from Portland from this specialist. And I finally destroyed that letter a couple years ago. I mean, it made me very upset. Here's this letter from this specialist who says, your daughter has a muscular disease and she probably will live a very normal life. And she was dead. Now, can you see why I'm not 100% trusting when I see test results, or, you know, one doctor says one thing, another says another thing. And what I should have done is actually contacted that doctor and I'll say it very bluntly, raised some hell. Because that was very inappropriate to send me a letter like that, when apparently this physician sent my primary doctor the truth. And it took me a long time to get over that letter. I held this letter, like I said, she had been dead 3 months, and I held this letter in my hand, and I thought, how can someone call themselves a doctor and actually treat patients that way? So I got over it. I have learned to forgive people. But I really prayed about doing this video today because I really didn't know if I should. But I've seen people misdiagnosed, and maybe they could have been saved if they were diagnosed correctly. It's like my lymphedema. I'm in rehab, and the doctor has explained it so well, and I've done a lot of research. And the sad part about it, and this is more prone to women. I very seldom, once in a while a man will get it, but it's mostly to women. And so many doctors will just say that the patient is fat, and it has nothing to do with obesity. So just remember, and I'm not trying to tell you this to not respect your doctor, or because there's a lot of good ones out there. The cardiologist that I go to right now, and the other doctor who did a vein treatment on my leg, fantastic. I have total confidence in these two doctors. But in my career and in my private life, I've seen a lot of doctors that aren't good. And I will, since this happened years and years ago, and I will not say where I worked, or it wasn't in the hospital, it was in a nursing home. And I didn't say anything about it to my superior. I should have. I probably would have lost my job though. But there was a doctor who came in and went to see his patients, and this one lady was in the dining room eating, and he pats her on the shoulder and says hello, and she proceeded to talk, and you could tell from the look in his face he was not paying attention whatsoever to what she was saying. And then he went to the nurse's station and pulled out her chart. And after he got through documenting what he was documenting, and he left, I picked the chart up and read it, because I also had to document, that she was seen by the physician. And he also put a phony blood pressure down, and he didn't take her blood pressure. He didn't even listen to her. So this happens, people. This happens. And so just be aware. Just be aware. It's your life. It's your body. And right now, I see people wearing masks in their car when they're all by themselves, and it drives me crazy. When I go into a store, I wear a mask. When I get into my car, I take it off. You're not breathing really good with the mask on. And I'm going to say something I shouldn't say, but there was something on Facebook that was kind of funny, I thought. And it said, it was kind of a cartoon. You probably have seen it. Something about if a fart can come through your pants, What about a mask? You know, it's good to wear it. You have to wear it. Most stores are requiring it. And like I said, I wear it. I'm not in a panic. And I also have watched people wear gloves and they're touching stuff in the store. And then they'll adjust their mask so they're touching their face. And then they throw their mask in the cart or on the floor. So, come on. Let's be good citizens. Let's not do that. And let's be cautious with our life, but let's not be in a panic. Remember, stress is a big factor in heart attacks. So take care of yourself. Anyway, I will show you, this is my precious little girl. She was 9.5 years old and she passed away in 1969. But the reason why I brought both of these up, I just wanted to point out to use common sense. If you have a funny feeling about something, listen to your gut feeling. If you're not comfortable and satisfied with your physician, maybe even your personalities clash, find another one. Insurance companies are great about, most of them anyway, at least the one I have, they have told me if you're not happy with a doctor, we'll find you someone else. So use common sense, get educated. Anyway, have a great day. I know there's going to be some negativity about my video, and like I said before, that's not what this channel is for. And by the way, if there's a subject that you would like me to do some research on, or that maybe I already know about, I do a lot of research in my life. I enjoy it. I like going back to George Washington and studying history, and it's enjoyable for me. So have a great day. Be safe, stay healthy. Bye, everyone.